Hi everyone. Now we are going to see the topic pharmacist relation to his trade. In pharmacist relation to his trade, first of all, price structure. The price being charged from the customer should include the quality and quantity of the commodity supplied. The knowledge, skill, time consumed, and responsibility of the pharmacist should also be considered while managing their earning, but the customers should not be burdened with the excessive taxes. Fair trade practices. Prices, gifts, or any kind of allowance should not be offered. Low prices for medical commodities should not be charged intentionally. If an order on prescription of a customer to be served by some other dispensary is mistakenly brought to any other dispensary, uh, Tata should direct the customer to right place without accepting the prescription. The labels, trademarks, signs, symbols of other contemporaries should not be copied. Purchase of drugs. Drugs should be purchased only from the genuine and reliable sources. A pharmacist should not assist the manufacturing, profession, distribution, and sale of spurious or substandard drugs. Havocing of drugs and medications should neither be havocked nor should be sold from door to door. Pharmacies and drugstores should not follow the self-service method. Encouraging self-medication is undesirable. Advertising and displays. The pharmacist should not use any display material for the sale of inappropriate medicines or medical appliances such as wording, design, and or illustration unfavorably reflecting on other pharmacists, disapproving references to other suppliers' product, remedies, or treatment. Misleading or exaggerated claims. The word cure for any disease or symptoms of any disease. Guarantee of therapeutic efficacy or treatment. Appeal to fear. Offer to refund the paid money. Price, competitions, or similar scheme. Reference to medical practitioner or a hospital or use of terms doctor or nurse with the name of a preparation not established. Reference to sexual weakness, premature aging, or loss of virility. A premise should not advertise any kind of display material mentioned above. It is allowed if the reason for such advertisement is genuine. So now so now we are going to see that pharmacist in relation to his medical profession. The pharmacist plays an essential role in medical profession by acting as a mediator between a medical profession and patient. So a pharmacist is an mediator between a medical profession and patients. There are few limitations are faced by pharmacist in his profession. First of all, limitations of professional activity. The medical practitioners, that means RMP, do not open drugstores because it leads to coded prescription or monopolistic practices. Approves disadvantages for profession of pharmacy or interest of patient. It makes the proof for disadvantage of profession of pharmacist and make the patients very uninterested. Second, pharmacists should not diagnose disease and prescribe medicines even if the customer asks them. In accidental or emergency cases, a pharmacist may be help the victim with first aid. Next, clandestine arrangement. A pharmacist should not make a secret agreement or contract with any physician who would provide him commission or advantage by recommending the patients to his drugstore. Libation with public. A pharmacist should always keep his knowledge upgraded by reading books, journals, magazines, and other periodical regularly. Information acquired by the pharmacist during his professional activity should not be revealed. Next, pharmacist in relation to his profession. With relation to his profession, the pharmacist should follow the following ethics. Professional vigilance. A pharmacist should be law-abiding citizen. They should prevent doing activities offensive to the society as well as to the pharmacy profession. His duty is also to force others his duty is also to force others to comply with the pharmaceutical professions and other laws and regulations. It is essential for the pharmacist to help and cooperate with the fellow members in his needs, scientific, technical, or else he should be aware of the undesirable and move them out of profession. These helps maintaining the name and traditionals of the pharmacy profession. Next, law-abiding citizen. A pharmacist should be well educated and should possess a fair knowledge of laws of the land. He should be aware of all enactment related to food, drug, pharmacy, and health sanitation should comply with them. A pharmacist's life cannot be divided into different sections as he has to act as a whole unit. Relationship with professional organization. If a pharmacist wants to train his professional colleagues about corporate life, he should connect with and motivate certain organizations which favor the scientific, moral, and cultural well-being of the pharmacist and are not working against the code of pharmacy ethics. Next, decorum and propriety. A pharmacist should avoid doing activities which are not in accordance with the dignity of pharmaceutical profession and can bring dishonor to the profession or to him. So these are the code of pharmaceutical ethics that should or must followed by the pharmacist. Thank you.